Hey, future IAS officers, you ready for a deep dive?
Let's go.
All right, so today we're talking all about maternity benefits here in India.
Yeah,
And, this is something that's important for all the UPSC aspirants listening out there
absolutely.
because this could come up both in mains and in prelims.
Yeah.
So we're going to be talking about this based on a really interesting article from The Hindu.
Okay.
And it was titled Maternity Benefits in India, Policy Gaps and Reform Imperatives. So let's just jump right in.
Okay.
And imagine yourself, right, as a policymaker, sitting there in that IAS chair. What are some of the things that you would be thinking about
Sure.
when you're trying to ensure the well-being of expectant mothers across all of India? It's one thing to have these laws on the books, but
Right.
how are things actually happening out there?
Yeah, I mean, if you look at the National Food Security Act of 2013,
Okay.
which, for shorthand, we call the NFSA, it had this really commendable goal of trying to provide 6,000 rupees for each pregnancy to women who were outside of the formal sector.
I see.
And that was really to help kind of, provide a safety net for them.
That's great.
During this critical time.
Right, but that was way back in 2013.
Exactly.
So if you adjust that, what would that even be today?
Yeah, I mean, if you adjust for inflation,
Yeah.
we're probably talking closer to 12,000 rupees.
Okay.
But that's not what's happening today.
Right.
What we have now is we have the PM Matru Vandana Yojana, which is also known as PMMVY.
PMMVY.
And this only provides 5,000 rupees. And that's only for the firstborn child.
Oh, wow. Okay.
Now, recently, it's been expanded to include the second child, but only if it's a girl.
I see. So that's a little different.
It's not universal.
Yeah.
The NFSA, it seems like they were trying to make it universal. But PMMVY, it seems like they're taking a different approach. What do you think about that? It's interesting, and I think, especially for UPSC aspirants who are out there listening, they always have to be thinking about how do you analyze policies? And, this really highlights a key kind of discrepancy.
Yeah.
That you have this NFSA, which had this broader kind of vision.
Yeah.
And then you have the PMMVY, which kind of deviates from that. So something to keep in mind.
That's really interesting. So we've got PMMVY now. How effective is it, really? Because we know in India, it's really hard to implement these big welfare schemes.
Absolutely.
So have there been a lot of failures with PMMVY?
Well, unfortunately, it's been kind of plagued with these implementation failures from just a lot of bureaucratic hurdles and also a real lack of transparency.
Okay.
The people who are supposed to be benefiting, the beneficiaries, they often face so many obstacles.
Yeah. And there was some data on that, right?
Yeah, so there were some RTI queries.
Yeah.
And those really highlighted that the coverage of the PMMVY, the amount of people who are getting the money, peaked at 36% in 2019-2020.
So only a third of the people who are supposed to be getting it were getting it. Wow.
And the even more shocking thing is that in 2023-2024, it plummeted down to just 9%.
That's wild. How does that even happen?
Yeah, well, the ministry hasn't really been clear about what exactly is going on.
Okay.
But through these RTI responses, what we're finding is it looks like there were some software changes.
Okay.
And it looks like the processes are just overly complex,
Gotcha.
which has led to these huge problems.
So it's really those administrative challenges that can kind of make or break
Absolutely.
a policy, even if it's good intentioned.
You got it.
And it seems like this, move to make things digital, to streamline things, is actually having the opposite effect.
Yeah, it's really backfiring in a lot of ways. And this brings us to another big problem with the PMMVY.
Oh, no.
What's that?
And that is that it relies so heavily on Aadhaar-based payments and digital verification.
And I see how that could be a problem for women especially who don't have access to technology or who don't really know how to use it that well.
Exactly. It can create this huge barrier to being able to even access these benefits. And even for the women who do have access. Think about the technical glitches, all the complicated procedures. It can be so discouraging and frustrating.
Yeah, it's almost as if the system itself is pushing people away from these benefits, which are so important.
It really is. And it's really important for all of our UPSC listeners out there to think about this whole concept of the digital divide.
Okay.
And how when you have these big policies, especially targeting vulnerable populations, that the way you implement them needs to be much more inclusive. That makes sense. Yeah. It really makes you wonder, though, like, are these just mistakes that are happening?
Yeah.
Or are they really trying to, limit access and cut costs on purpose?
That's an interesting point. It's something to think about. And I think, for anyone who's really interested in policy, it's not just about what's on the surface. It's about what are the motivations behind the policies. And this is really where your analytical skills are going to come into play for the UPSC. Don't just look at the surface, look at what's underneath.
That makes sense.
Yeah.
So we've talked about a lot of the challenges so far, but it's not all bad news, right? Like, there are states in India
absolutely,
that are doing this well.
Right. And this is what gets me really excited. Is when we look at these state-level models that are really working. We can get so many insights from that. And even inspiration for how we can improve things at a national level.
Yeah, absolutely. Like, for example, Tamil Nadu.
Tamil Nadu is a great example.
Yeah, their maternity benefits scheme is great because they're giving 18,000 rupees.
18,000?
Per child. I mean, that's huge compared to 5,000.
Yeah.
I mean, that could make such a big difference in people's lives.
Absolutely. I mean, that extra money could mean that a mother is getting good prenatal care, nutritious foods, a safe and hygienic birthing environment. It's a big deal.
And that's what's really great about Tamil Nadu is that they've really made it user-friendly.
Right? Exactly. They've made it so easy to access. Right. You don't have to deal with a lot of paperwork.
Gotcha.
It's streamlined and it's simple.
So do we know how much, what's the coverage like there?
Yeah, so their coverage in 2023, I think it was 2023, 2024, was 84%.
Wow.
Which is phenomenal.
That's incredible. So, if they could do it, why can't everyone else?
Right. And this is a great example of how when you have a good government that's really committed to social welfare, you can actually get results.
That's great. And it's not just Tamil Nadu, right? Like, Odisha is also doing a good job.
Yeah.
With the Mamata scheme?
Yeah, Odisha, with their Mamata scheme, they're providing 10,000 rupees per child, and they just doubled it.
Wow.
Which is awesome.
And it's not just for the first child.
No.
Or a girl child. Right?
Exactly. And that's what's really interesting. Both Tamil Nadu and Odisha have this very inclusive approach. Yeah. They're saying every child deserves a healthy start, regardless of family size or the gender.
That's awesome. Do we know what their coverage is like?
Yeah, so their coverage in 2021, 2022 reached 64%.
That's great.
And a lot of that has to do with how simplified their procedures are and how they have these direct outreach efforts.
So it's really proving that it can be done.
Yeah.
It's not impossible.
Exactly. It's about political will and a commitment to your people's well-being.
Absolutely.
Yeah.
And for all the UPSC folks out there, this is a great takeaway for you guys. Because when you're looking at these successful models, that can be so helpful for crafting those persuasive arguments and proposing innovative solutions for your exams.
Absolutely.
And also for your future careers.
Yes.
So we've talked about the good, the bad, and the ugly. So what are some of the things that we can do to make things better for the future of maternity benefits in India?
So, looking at all the different problems, I think a really important first step is to expand the PMMVY to include all children, regardless of birth order or their gender.
And that goes back to...
Yeah, it goes back to the vision of the NFSA.
Exactly.
And it really shows a commitment to equity and support.
Yeah, absolutely. Every child deserves that. So besides that, what else can we do?
Well, I think we also need to be realistic about the money. So right now, it's $5,000.
Yeah.
But we need to increase that to at least $12,000.
Okay.
And we need to adjust it for inflation.
Yeah.
Because we want to make sure that the money that they're getting is actually meaningful.
Absolutely, yeah. And also thinking about the whole implementation process, right? Yeah. We need to make it less tech-heavy.
We can't keep having these complex systems that are alienating and discouraging people from participating.
So simplifying things, getting rid of some of that bureaucracy,
right,
making it more user-friendly, and maybe taking a page from Tamil Nadu and Odisha.
Absolutely.
And their approaches.
And another thing that I think is really important is transparency.
Okay.
We need to know how the program's doing, how many people are actually getting the benefits, and how is the money being allocated. Yeah. This is really important for good governance and accountability.
Because transparency builds trust, right?
Absolutely.
Yeah. And this is something you'll see again and again as you're studying for the UPSC.
Absolutely. You know, these are all really critical things for not just policymakers, but for you guys, the future civil servants, because you're going to be the ones who are implementing these programs and improving them.
So it's about really understanding the little details, figuring out what's missing.
Yeah.
And coming up with solutions that are actually going to work.
Exactly. And that's really the heart of what you're going to be doing as future leaders.
Absolutely.
And the great thing is the more you think about this stuff now, the more prepared you'll be.
Yeah, I totally agree. And don't forget, like, there's always more that we can learn. You know, keep exploring. Keep asking those questions. And, you know, be inspired by those who are really doing a good job.
Exactly.
I mean, I'm curious, have you come across any, like, innovative approaches?
Yeah.
To strengthening India's safety net for expectant mothers out there through your research?
Yeah, I mean, one example that comes to mind are these conditional cash transfer programs.
Oh, what's that?
You've never heard of that?
I haven't.
Well, basically what happens is they provide extra money to mothers if they do certain things that are good for their health and well-being.
So it's kind of like giving them a little extra help.
Right.
If they do certain things.
Yeah, it's an incentive.
Okay.
So, for example, they might get extra money if they go to all their prenatal checkups, or if they get vaccinated, or if they make sure their child gets their immunizations. Okay. So it's kind of a way to encourage these healthy practices while also providing them with some financial support.
Yeah. That sounds like a win-win.
It really is.
For everyone involved.
Yeah, because it means better health outcomes. And it means that they have the resources they need to really thrive.
That's awesome.
And there are so many more ideas out there.
Yeah.
The key is to keep learning and keep looking.
Yeah. And this is really what the UPSC is all about, right? Creating a better India.
Absolutely.
So, you know, as you're studying, keep that in mind. You know, challenge what you think you know.
Right.
Look at things from different perspectives.
Yeah.
And always be on the lookout for those creative solutions.
Absolutely.
That can really make a difference.
You got it. And who knows, maybe one day you'll be the one coming up with those solutions.
Yeah, that would be awesome.
Yeah.
To use all this stuff we're learning and actually go out and make a difference.
Yeah.
In the real world.
That's what's so powerful about this whole journey with the UPSC.
It's not just about passing the exam. It's about being ready to go out and take India a better place.
Absolutely.
So before we move on, we want to hear from you.
Yes.
What are your thoughts on this? You know, share your questions, your insights.
Yeah, tell us what you think.
In the comments below.
Absolutely.
We love hearing from you guys.
You do.
It makes doing this so much more rewarding.
Yes, definitely.
And, hey, if you like this, hit that like button, subscribe to the channel.
Yeah, don't forget to share it.
Tell all your friends who are studying for the UPSC. Because the more we have these conversations, the better prepared we'll all be.
Absolutely.
Because in this journey, it's not just about cracking the exam, right? It's about becoming those civil servants who are going to make a difference.
Exactly. And it's about developing those skills, that empathy, to really make a positive impact.
Absolutely. And, you know, we've seen today that even with all these challenges, you know, these shortcomings, there's always hope. Yeah. There are those people out there doing great work.
Right.
We just have to be looking for it.
Yeah.
And keep our minds open.
Absolutely.
So that's it for our deep dive into maternity benefits here in India. And we hope that this has, you know, made you a little bit more curious and helped you understand what's going on out there. And don't forget to check out the article in the Hindu that inspired all this.
Absolutely.
Leave your comments below.
Yes.
We love to hear what you think.
We do.
And until next time, happy studying.
Keep those UPSC dreams alive.
And keep diving deep.
Absolutely.
So we were talking about how Tamil Nadu has this great system in place.
Right.
They're giving that 18,000 rupees.
Yeah.
And you were saying the coverage is awesome.
Phenomenal. Yeah, it really is.
Like 84%?
Yeah, 84% in 2023, 2024.
So impressive.
And what I think is so cool about what they've done is they've really thought about the user.
Okay.
Like, how can we make this easy?
Yeah.
So you don't have to do a ton of paperwork. You don't have to go through a ton of hoops.
Right.
It's streamlined. It's simple.
Yeah. That makes a big difference.
It really does.
And then you were talking about Odisha.
Yeah.
And the Mamata scheme.
Yeah.
And they're giving 10,000.
Yeah. So originally they were giving 10,000, but they just doubled it.
What? Really?
Yeah, which is awesome.
That's great. And they're not limiting it?
No.
Based on whether it's a boy or a girl or...
Exactly. And I think what's so cool about what both Tamil Nadu and Odisha are doing is that they're really committed to this idea of inclusive maternal welfare.
Okay.
You're saying, you know what?
Yeah.
Every child deserves this.
Right.
Regardless of how many kids you have or whether it's a boy or girl.
Yeah, it shouldn't matter.
Exactly.
So do we know how their coverage is?
Yeah, so their coverage reached 64% in 2021, 2022.
Wow, that's still pretty good.
And that's because they really focus on simplifying their procedures, and they have all these direct outreach efforts.
So they're going out and finding the people.
Exactly.
Right.
They're making it easy for people to get this money.
So it shows it can be done.
It can be done. It's about having that political will and that commitment to your people's well-being.
So for all of our UPSC listeners out there, these two states are great examples of what to look at, you know, because when you're coming up with your answers for your exams, you can use these as like models for argumentation.
And proposing solutions.
Exactly.
Absolutely.
Okay, so we've talked about some good stuff now.
Yeah.
What can we do like nationally?
Right,
You know, using maybe some of the stuff we've learned.
Yeah, so I think a really important first step is we have to expand PMMVY to include all children. No matter if it's the first one, second one, third one.
Regardless of gender.
Regardless of gender. And I think that really goes back to that original vision of the NFSA.
Right, because everyone deserves a healthy start.
Absolutely.
And then what about the financial side of things? Because
so we can't keep giving people 5,000 rupees. Like, that's not enough.
Especially with inflation these days.
Exactly. So we need to increase that to at least 12,000.
Okay.
And we need to make sure it's adjusted every year for inflation.
Oh, okay.
So that it's actually a meaningful amount.
Yeah, so they can actually use it to make a difference.
Exactly.
What about this whole thing we were talking about with implementation and making things less complicated?
We can't keep alienating people with these systems that are way too complex.
Yeah.
You know, we need to simplify things. We need to reduce bureaucracy.
Yeah.
Make it more user-friendly.
And you know what?
Yeah.
Tamil Nadu and Odisha,
they've shown us how to do it.
They figured it out.
Exactly. So we should learn from them.
And we've also got to have transparency.
Yes, transparency is so key. We need accessible data on how these programs are performing. How many people are actually getting the benefits? How's the money being used?
Right. Like, where is it going?
Exactly. Because that's how we have accountability.
Yeah. And that builds trust.
Absolutely.
And when people trust the government, they're more likely to participate in these programs.
Absolutely. And this is something that's so key for you guys who are studying for the UPSC.
Yeah.
Because this concept of good governance and transparency, it's going to come up again and again.
Absolutely. So, you know, really think about these things.
Yeah, this isn't just theoretical.
Yeah.
This is real life stuff.
These are people's lives we're talking about.
Exactly. You know, you guys are going to be the ones implementing these programs and making them better.
So thinking critically now is going to help you so much in the future.
Absolutely.
So it's not just about, you know, memorizing facts and figures.
Right.
It's about really understanding the nuances.
The why.
Yeah, the why.
The how.
Yeah, how it actually works in the real world.
Exactly.
And coming up with solutions that are actually practical and effective.
Absolutely.
That's what's going to set you apart.
Yeah.
Not just in the exam, but in your careers.
Exactly.
So I'm curious, have you come across any other...
Oh, yeah.
Like really innovative approaches
so many
to strengthening India's social safety net for expectant mothers?
Yeah. I mean, there are so many creative solutions being implemented all around the world.
Okay, cool.
One that I think is really interesting is this concept of conditional cash transfer programs.
Conditional cash transfer programs.
Have you heard of that?
I haven't.
So basically, they give mothers extra money.
Okay.
If they do certain things.
Like what kind of things?
So things that would be good for their health and well-being.
Okay.
So for example, let's say a mother goes to all of her prenatal checkups.
Okay.
she might get extra money for that. Or if she gets all the necessary vaccinations.
Okay.
Or if she makes sure that her child gets all of their immunizations.
I see. So it's like an incentive to do all the things that are good for them.
Yeah, it's encouraging these healthy practices while also giving them some financial support.
So it's like a win-win for everyone.
Exactly, yeah.
Because then you have healthier moms, healthier babies.
Absolutely.
And they also have some money to help them along the way.
Exactly.
That's so cool. And you said there's other stuff out there too.
Oh, yeah. There are so many other ideas.
Awesome.
And the thing is, we just need to keep looking and keep learning.
And you know what?
Yeah.
This is what the UPSC is all about.
Absolutely.
It's not just about passing the exam.
Right. It's about making a difference.
It's about using all this knowledge that you're gaining to actually go out there and create a better India.
Absolutely.
So as you're studying, keep that in mind.
Yeah.
Be curious. You know, challenge what you think you know. Look at things from different perspectives.
Absolutely.
And always be looking for those solutions that can actually make a real difference.
Yes, exactly. And who knows, maybe one day you'll be the one designing and implementing these groundbreaking policies.
Yeah, that would be amazing.
Right.
To be able to take everything you're learning and use it to make a real impact.
Yeah, and that's what's so amazing about the UPSC journey.
Yeah, it's a really powerful journey.
It is.
That you're on right now.
Absolutely. And it's not just about the destination. It's about the journey.
Yeah, absolutely.
Embrace the challenges. Celebrate the victories.
Yeah.
And never stop learning.
We really want to hear from all of you listening.
Yeah.
What are you thinking about all this?
What resonated with you?
What kind of innovative approaches do you think would help strengthen India's social safety net for these expectant mothers?
Tell us in the comments.
Yeah, we love hearing from you guys.
Yeah, it makes this whole thing worth it.
Yeah, so, you know, this deep dive into these maternity benefits, it's really shown us that it's not just about the textbook stuff.
No, it's about connecting the dots.
Yeah.
It's about understanding what happens when you put these policies into practice and then thinking about how you can close that gap between what you wanted to happen and what actually happened.
Yeah, and I feel like those are the things that are really going to help you stand out, not just in the UPSC exam, but in your careers as civil servants.
Yeah, because it's not just about memorizing all the facts and figures.
Right.
It's about understanding the why.
Yes.
The why. Why are we doing this?
Yeah.
What's the point?
What are the problems?
What are the challenges? Yeah. And then thinking about the people whose lives are actually being affected by this.
Yeah, and sometimes those stories are the most important.
Absolutely.
You know, to really highlight why this stuff matters.
Yeah. Yeah. And I think that's a really important thing for all the UPSC aspirants to keep in mind. Yeah. You know, every statistic, every policy, it represents real people who are being impacted by these decisions.
And as future policymakers, we have to keep that in mind.
Absolutely.
You know, we're doing this for the people.
Yeah, we're trying to create a more just and equitable society for everyone.
That's such a good point.
Yeah.
And that's something that I really hope all our listeners take with them.
Yeah.
You know, not just for the UPSC, but for life.
Yeah. It's about empathy. Yeah. It's about compassion.
Yeah.
And it's about understanding the struggles of the people we're serving.
Absolutely.
And then having the courage to challenge things, to think outside the box, to come up with those creative solutions that can make a real difference.
Because this UPSC journey, it's going to change you. It's going to give you the tools and the mindset to really go out there and do amazing things.
Yeah, you got it.
So keep that fire burning.
That passion.
Yeah, let curiosity be your guide.
Yes.
Let knowledge be your weapon.
Yes.
And let compassion be your compass.
Absolutely.
And never forget, you have the power.
You do.
To change India.
Yes, and remember, it's not just about the destination. It's about the journey.
Yeah. So enjoy the ride.
Absolutely. Embrace the challenges, celebrate those little victories, and never stop learning.
So that wraps up our deep dive into maternity benefits in India. And you know what we really hope is that this is, you know, made you think about things and maybe even sparked your own ideas for how to improve.
Absolutely.
Thanks.
Yeah. And don't forget to check out that article from the Hindu.
Yeah, it's a really great read that inspired this whole conversation. And leave your thoughts, your questions. Yeah. Any insights.
Yeah, tell us everything.
In the comments below.
We want to know.
We love hearing from you guys.
We do.
Until next time.
Keep those UPSC dreams alive.
Keep diving deep.
Yeah.
And we'll catch you the next one.
See you later.